Hello everyone. Today let's discuss on anemia, a very important high yield topic for your MRB exam 2026. I'm going to tell only a very important points here. So what is definition of your anemia? So definition of anemia here is when the hemoglobin is less than -2 standard deviation for the mean of for age and sex. Okay, so when the HB is, that is hemoglobin, is less than -2 standard deviation, the mean for the particular age and sex is the definition of your anemia. What is the WHO cutoff values for anemia? How you can remember this? So cutoff value for 6 months to 5 years age group is 11. For 5 years to 11 years is 11.5, and for more than or equal to 12 years is 12. So you can remember it like this. For 12 years it is, for more than or equal to 12 years it is 12 gram per deciliter. For 5 years to 11 years it is 11.5 gram per deciliter. From 6 months to 5 years it is 11 gram per deciliter. This is the cutoff value for your for particular age group to tell that the child is having anemia or not. I'm not going into detail of mild, moderate and severe anemia. Okay, that we can cover it in our next topic, or that will be a important question only in your NEET PG 2026 and also in your INISET. Okay, here you have to know about the important difference and the most frequently asked questions, difference between iron deficiency anemia, thalassemia and anemia of chronic disease. Okay, first is your HB. How will be the HB in this three? HB will be reduced in all of these three, that is iron deficiency anemia, thalassemia and anemia of chronic disease. What is the value of your serum ferritin and how the serum ferritin will help to differentiate? The serum ferritin will be very low in your iron deficiency anemia, while it will be normal in thalassemia, while it will be very increased in your anemia of chronic disease. Why so? Because serum ferritin is your nothing but your acute phase reactant, so it will be increased in your anemia of chronic disease. Okay, next component is your TIBC, that is your total iron binding capacity. Total iron binding capacity will be increased in iron deficiency anemia, whereof in thalassemia it will be normal. In anemia of chronic disease it will be reduced. This is also particular differentiating features between these three. So TIBC will be increased in iron deficiency anemia, it will be normal in thal, and it will be decreased in anemia of chronic disease. Next is your MCV, that is MCV will be very decreased in iron deficiency anemia. It will be decreased, very much decreased in thalassemia. That will be a disproportionately microcytosis will be present. A disproportionate microcytosis will be present in your thalassemia, while in anemia of chronic disease it will be normochromic and normocytic anemia. Okay, it is a normochromic normocytic anemia in anemia of chronic disease, while it will be decreased in iron deficiency anemia, while in thalassemia it will be proportionately decreased. Coming off to your RDW. RDW is nothing but your red cell distribution width. Your red cell distribution width will be increased in your iron deficiency anemia, while it will be minimally increased in your thalassemia, while it will be normal in your anemia of chronic disease. These are the important points or important differentiating features you need to know, and it is a very important differentiating a tabular column that you have to know how to differentiate between these three, and it will also be an important question for you. Next, what is a Mentzer's index? Mentzer's index is nothing but it is MCV divided by your RBC count. For what we are using this index? This is used to differentiate between your iron deficiency anemia and thalassemia. It will be more than 15 in your iron deficiency anemia, while it will be less than 15 in your thalassemia. Okay, so these are the important points you need to know about anemia for your TNMRB 2026. So definition of anemia, that is your hemoglobin is less than -2 standard deviation for the particular age and sex, while the cutoff values for age group 6 months to 5 years is 11, for 5 to 11 is 11.5, for more than or equal to 12 years is 12. So difference between your IDA, thalassemia and anemia of chronic disease, main differentiating point is your serum ferritin and your TABC. So serum ferritin will be low in iron deficiency anemia while it is increased in your anemia of chronic disease, while your TABC will be increased in IDA and decreased in anemia of chronic disease. Next will be your Mentzer's index, which is a very important for differentiating your iron deficiency anemia and thalassemia. The value is more than 15 in IDA and less than 15 in thalassemia. Thank you. These are the important points you need to know. Thank you so much for your patience listening.